here today to give our community an update on our COVID-19 status and also our efforts to get our community vaccinated with the COVID-19 vaccine. Today, I'm happy to report that we have begun vaccinating our community. We started on Christmas Eve, December 24th, and vaccinated 20 of our staff, to include myself. I'd like to remind our community that the state has set up tiers as far as a priority for vaccinations. At this point, we're working very hard to get the first tier vaccinated. That first tier includes our hospital staff, EMS staff, first responders in the community. This also includes funeral professionals and our school teachers as well. Following that, we're working very hard to get people over 65 and vaccinated first. They're the priority. Also important to understand too that we have to provide these vaccinations in groups of 10. So I would encourage our community, if you are interested in this vaccination, go ahead and call the clinic and get on our list. We're trying to move as many people as we can through the system. There may be an opportunity for you to move up on a list if you can come in quickly and take a vaccination. We're working very hard to do our part to get people vaccinated as soon as possible. I think it's very important for the community to understand we have got to get to a level of herd immunity in our community and in our country as well. What is that going to take? That's going to take people getting vaccinated. I would encourage you, each of you, get your information from reliable sources, from scientific data, from your healthcare provider. Don't base your decisions based on social media and rumors. Following that, it's going to be very important that we continue to wear masks, do our social distancing, to get us through to the point where we can get to that level and get this virus under control. Beyond that, we're going to get as much of this community in here as quickly as we can. It's important to understand too that we're limited by the number of vaccinations. We received an initial dose of 200 back right before Christmas. We've worked through those. We received an additional allotment of 300, and we're about to work through those as well. So we're working very closely with the state to get more of these vaccines in so we can get as many people vaccinated as possible. We don't have a definite timeline on allocations of additional vaccine. However, please know that we are working with the state. Once we get these allocations, we'll be moving very quickly, contacting people on our list to get them in here to get these vaccines. We know that it's very important to the citizens of our community to become vaccinated. We encourage you to go ahead and contact our clinic. Please understand and be assured that we will move as quickly as we can once we receive the vaccines. In the meantime, while you're waiting on your vaccine, please continue to monitor information from our hospital, monitor our Facebook page. We'll get accurate information out just as soon as we can to educate our community. In the meantime, we encourage you to please contact our clinic and get your name on the list. Unfortunately, we won't be able to give you an exact time or a day for your appointment, but please be assured that our staff are working closely with the state. Just as soon as we get these vaccinations in, we'll be contacting those on the list to get them in here for their vaccination. We also encourage you to locate reliable sources of information regarding COVID-19. We know there's a lot of information out there, a lot of misinformation. We want you to be well informed. We want to make sure that you get the information you need to make sure that you keep you and your family safe and healthy.